Vermont's special traditions, which is Greenup Day. It would normally happen this weekend, the first weekend of May, but unfortunately, nothing is normal these days. Greenup Day represents what's so great about Vermont, each of us stepping up to help serve the greater good. We've seen it after Irene, and we've seen it in our response to this pandemic as well. While Greenup Day won't officially happen this year, I'm asking Vermonters who may be out on a walk or hike this weekend to take a bag or two with them and help keep the state green in honor of this tradition. As we've been doing on Fridays as well, Commissioner Pichek will be presenting our latest modeling. And what you'll hear is that because we've stayed home and stayed separated, we continue to move in the right direction. I want to be sure that everyone understands we can't declare victory yet because we have to look regionally. We have to recognize that states like Massachusetts, Connecticut, New Jersey, and New York, states right on our borders or just a few hours away, are still dealing with massive outbreaks. And it only takes one spark to reignite this fire. We all need to stay smart, be cautious, and disciplined. But our latest data does give us the opportunity to take some additional steps this week. Now, as a reminder, this is done in consultation with our public health experts, Dr. Levine and the EPI team, as well as the Emergency Operations Center, the Agency of Commerce, and our Restart Vermont Task Force. This entire group is committed to putting public health first and letting the regional data guide this work and not an arbitrary timeline. I also want to make clear that as we put more people back to work and increase our testing, as we announced just last Wednesday, we could very well see an uptick in COVID-19 cases. So as we slowly open the spigot, we'll keep an eye on the data so we don't lose ground, and instead of focusing on total numbers, we'll need to track the trend lines. The important thing to know is we'll be watching this closely, either helping us to expand more or telling us to slow down a bit. And I'm pleased to say we're able to get thousands more Vermonters back to work starting Monday. In the order I signed this morning, manufacturing, construction, and distribution businesses can operate with 10 or less employees beginning May 4th, which is Monday, if they meet certain safety requirements. Beginning May 11th, these same businesses can restart full operations if they comply with additional stringent requirements. As we've done each time when we put more people back to work, this order also includes more health and safety protocols. For instance, businesses will be required to do temperature checks as part of the employee screening required in my last order. Although I recognize thermometers are in short supply these days, but employers must make a good faith effort to place orders and comply as early as possible. As you might remember, last week, VOSHA built a training program that, at a minimum, employees must complete by May 4th. This new order builds on that, requiring businesses operating with more than 10 employees to look at their specific situation and provide expanded training in order to protect workers and customers. ACCD will issue guidance for businesses to help in this effort, and I'm pleased today to have Bill Scholdice of Vermont Teddy Bear and John Connor of Connor Construction to share a little bit about how they prepared to make sure the manufacturing and construction sectors are putting health and safety first as more of their employees get back to work. What you'll hear from them is really important because it will show why we're comfortable moving forward with more people going back to work. Our ability to limit the spread of this virus is key to reopening. As you know, there's no playbook on any of this. So we focus on sectors like manufacturing and construction that have controlled environments, open space, and are accustomed to following rules to provide for safe work sites. They'll be able to set an example for others as we look to do more in other areas. I also want to highlight another new health and safety measure in today's order, which includes requiring all public transit employees and customers to wear cloth masks. We've already seen a shift in behavior with education and guidance in many of our entities throughout Vermont, and we appreciate Vermonters' willingness to do the right thing, which keeps people safe and helps us continue to ease other restrictions. I want to thank Vermonters for their continued vigilance and commitment to each other. I know this continues to be very difficult, and many are anxious, but if it keeps tracking the way it is, and the other states around us do as well, you can expect that early next week we'll be announcing some additional steps, not just for the business community, but for family connections and outdoor recreation. So with that, I'll turn it over to Commissioner Pichak.
Thank you very much, Governor. I'm Mike Pichak. I serve as the Commissioner of Vermont's Department of Financial Regulation, and I've also been leading the COVID-19 team here in Vermont on the forecasting and data modeling. Today is our 5th media presentation, and like the other briefings, I will first start with the insights from this past week and then preview our thinking as we look ahead. Our forecasting and data all indicate continuing good news for our state. As you can see from our first slide, we are continuing to perform better than our forecasts. This chart illustrates 5 recent forecasts predicting our confirmed case growth, and then our actual case growth is represented by the thick blue line. You can see that we continue to perform better and markedly better than our forecasts even from last week. These are all moving in the right direction and indicate a positive trend. We continue to attribute these better than expected outcomes to Vermonters' adherence to social distancing and hygiene guidance. On the next slide, you can see on the left our recent mobility data informs us that Vermonters are continuing to limit their activities and travel outside of their home. On the right, we also see a comparison of the other northern New England states. Again, Vermont compares quite favorably to those other states. You will notice that there was an increase in mobility over this past weekend, likely attributable to folks getting outside to enjoy the warm weather. This is expected as the weather continues to warm, and it is safe as long as we continue to practice social distancing while continuing to enjoy the outdoors. Our revised doubling chart helps demonstrate the significant case slowdown that we have seen. Last week, we were on track to have confirmed cases that doubled approximately every 37 days. Now you can see that estimate has been revised to every 84 days. Again, we can see this progression, first from days and weeks, and now to multiple months. On the next slide, we can compare Vermont's doubling rate to the rest of the country. Again, you can see that we're in a small grouping of states that are performing quite well and are experiencing much better and significant slowdowns than some of our counterparts. The next slide compares the virus growth across the Northeast. As the governor alluded to, you can see that other states in our region, particularly Massachusetts and Rhode Island, are experiencing a doubling rate of every two weeks, and the other New England states and Northeast states are seeing a doubling rate between every 3 to 4 weeks. Again, this is a good reminder of the challenges our neighbors are continuing to confront and the importance of self-quarantining when those are coming to stay here in Vermont. A continued encouraging trend is the reduction in hospital demand for COVID-19 patients. Further, each one of our models and forecasts indicate a continued decline in hospital resources in the weeks ahead, all of which are a good sign. You can see here on the chart that this is the actual hospitalization data, and that continues to trend in a good, positive direction. We have previously talked about modeling for 3 different peaks: the peak of new case growth, the peak in hospital demand, and the peak in the total number of active COVID-19 cases in Vermont. Our team has worked hard to develop a Vermont-specific forecast of active cases in our state. The model forecasts active confirmed cases and illustrates some assumptions for COVID-19 patients who were never tested. As you can see, we still have a significant number of active cases of the virus in our state, represented on the bottom yellow row. However, we expect a sustained and speedy decline of active cases in the days ahead. Accordingly, it's safe for us to assume that we have passed the peak on this important measurement as well. In the past, we have used the slide on slide 9 to illustrate the impact of social distancing measures on our case growth. We've represented this 10 to 14-day lag between the transmission of the disease and that individual getting a confirmed COVID count. Now, looking ahead, we're planning to use that same logic and understanding on the Restart Vermont initiatives. If you go ahead one slide, you can see that about 10 to 14 days ago, the first turn of the spigot was used, and now we are in that period, that window of the 10 to 14 days. Within this window, nothing is giving us pause or nothing is jumping out at us that is anything of significance. We are continuing to see a very low active case count, and we're continuing to see a very low 3-day rolling average of case growth, all below 1%, and all within this range of about 0.5% to a quarter or 0.75%. All, again, very good news. As we continue on these positive tracks here in Vermont, it's really due to the sacrifices of each and every Vermonter. It's important to remember, again, that our individual actions will continue to determine our collective outcome. This is why we need to continue to remain vigilant and follow social distancing and hygiene guidance, even while we take these small steps to reopen our state. Thank you very much, and now I'd like to introduce Dr. Levine.
Thank you. Today I've been asked to briefly discuss the public health context and the principles behind the phased approach and the pace of change the governor is taking to restart Vermont. As we know, the virus spreads through the respiratory route, and it thrives on close contact of human beings and the ability of people in a high contact intensity situation to spread infection to one another. So it follows that transmission indoors may be more likely than outdoors. We know the virus is transmissible in what I've termed before the pre-symptomatic period, which is at least 48 hours before a person actually becomes ill. We know that outbreaks can take off very quickly due to that concept called the R0, R0. What that is the ability of one person to infect 2 or 3 other people at a time, which rapidly leads to what's termed exponential growth. We know that we always need to prioritize protecting those people who are most at risk for severe consequences of the disease, and those people who are in group living settings like nursing homes or prisons. And as the governor has stated before, as we increase and expand testing, we are more likely to see a greater number of people who are infected and don't know it, but could infect others. So we need to continue to respect and keep our eye on the data and what the data tells us, and not just looking at absolute numbers, but looking at rates like growth rate, percent positive rate, some of the metrics that Commissioner Pichak just revealed to us. And then with enhanced testing, look for outbreaks, which have defined a significant proportion of our Vermont experience in terms of numbers of cases already, and those on the severe end of the spectrum of disease. And we always have to remember how we got to this point in flattening the curve. Physical distancing, facial covering, teleworking, now new added distance delivery methods for education, even telehealth. And understand that the pace of what got us here happened quickly. We've now somewhat leveled off that curve. We have to be cautious. We can't accelerate reopening to return to our former daily lives. We have to be a little more deliberate, but always forward moving. So as we are in the early phases of reopening, it doesn't make sense to return to the very early former close contact that we all had with one another and totally sacrifice physical distancing all at once, nor encourage mass gatherings all at once. What we've accomplished together and relatively early with restrictions on mass gatherings, visitations, school closures, and bars is noteworthy and can't be reversed as the first things that happen. And this concept of how intense our contact is with one another is really important. Obviously, high contact situations like living in dormitories can't be the first change that occurs, but it doesn't mean there isn't room for creativity to manage that. We may need to think about how settings like restaurants, auditoriums can be refigured to operate more safely. And just as low contact operations that involve few workers in an outdoor setting or businesses where people who can work independently are allowed. And of course, the overlying principle, a focus on health and safety, is the assumption that the way we've trained ourselves to behave as individuals, in our families, and in our workplaces will continue during this time period. Hand washing, staying out of work when ill, respiratory etiquette, environmental hygiene and disinfecting programs, having a safety officer, symptom monitoring before shifts begin, temperature checks, all of that continues on. And it doesn't mean we can't utilize public health, transportation. It can actually be a help much more than a hindrance when and if it's done correctly. You've heard us talk frequently about borders and the fact that viruses don't respect borders, and travel and borders will continue to be a significant focus. The risk of disease coming into the state from states that have far more disease activity, and the risk from Vermonters who may leave and then return from places where there's higher activity. But fortunately, Vermont creativity and innovation will continue to be in high demand more than ever, and I believe we'll even hear some more about how that can pay off. One other point I'd like to make today is that there's now a broader definition of COVID-19 symptoms so that more people are again eligible to get tested in our expanded testing strategy. Besides the traditional triad of fever, cough, and shortness of breath, additional symptoms now include loss of smell or taste, headache, muscle pain, sore throat, chills or shaking. Knowing this is all the more important at a time we as individuals and employers need to be aware of illness and continually curious about our state of health. I believe Commissioner Hurley is now going to speak.
Thank you, Dr. Levine. Thank you to your team as well for the incredible work that you're doing to keep Vermonters informed, safe, and healthy through this time. I wanted to take a few moments this morning to further explain some of the work happening at the Agency of Commerce and Community Development to reopen the state's economy and get Vermonters working again. We want Vermonters to know that our top priority as people return to work is their health and their safety. As we loosen restrictions over time, there is an immense amount of work that goes into ensuring each sector and industry has a concrete plan to protect their employees' health and well-being. It's also important for Vermonters to know that this work is not being done in a vacuum. The Agency of Commerce and Community Development, with the support of the Economic Mitigation and Recovery Task Force, is engaging with employers, industry groups, trade associations, and chambers of commerce to help us restart Vermont together. This engagement and collaboration with sector-specific leaders allows us to better understand, learn, and ultimately develop a path forward to reopening the industry that also meets health and safety priorities. It's important to note that for all businesses in the state, this is not and will not be a flip of the switch. The fastest way we are going to get back to business as usual is to acknowledge that business operations will be anything but usual in the coming days, weeks, and months. As Bill Scholdes of the Vermont Teddy Bear and John Connor of Connor Contracting will speak to, Each industry must look at their operations and how their businesses can operate within mandatory health and safety guidelines being announced each week. ACCD is grateful to Bill, John, and all of the others who have helped devise these work plans that keep Vermonters safe. Their work has been thoughtful, methodical, and helped to lead the announcements that we made today. I will close by acknowledging that many Vermonters remain uncertain of when they will be able to get back to work and when our communities and our downtowns can be again the centers of activity and support that we are all missing during this time. What I can offer is that thinking about how your business or your industry can operate in new, modified, or unique ways will ensure public health remains our North Star and give us the ability to continue to restart Vermont together just as soon as we possibly can. I will now turn this over to Bill Schuldeis of Vermont Teddy Bear.
Thank you, Secretary Curley. Thank you, Governor, for asking me to serve on the Restart Vermont Task Force. Today, I want to outline the manufacturing, distribution, and fulfillment sector's plan to reopen. For the past several weeks, at the Governor's request, I've assembled a group of economic leaders that includes the Vermont Manufacturing Extension Center, the Associated Industries of Vermont, the Vermont Chamber of Commerce, Chroma Technologies, Global Foundries, OnLogic, Maple Landmark, Dan Clark Limited, Vermont Precision Tools, and the regional development corporations around the state to chart a path forward for these sectors to get back to work safely. These industries and many others have the expertise to work in highly regulated environments and understand how to adapt to the needs of an ever-changing environment. We've drafted a recovery plan that puts Vermonters' health first while allowing Vermonters to get back to work. Let me take a few minutes to just cover some of the specifics. It is a three-phased approach. We're in phase one now, as the Governor spoke, and we anticipate advancing to phase two on May 11th, provided that, as we've outlined in the plan, employee training protocols are met that include social distancing practices. These recommendations encourage business to change the way they do business to accommodate social distancing. We also understand the stress that Vermont families are under, with schools being closed. So the plan includes the ability to work in shifts to help families accommodate their needs. It will include mandatory facial covering for all employees and limited visiting and vendors at this time. I want to highlight that today at 1:30, the Manufacturing Extension Center will begin conducting training sessions that are focused on COVID-19 best practices in preparation for their opening. It's our hope we'll use the coming week to do the training so we can have a opening that is complete and started on May 11th. I want to be clear, our sector is not returning to normal today. We understand that how we do business will determine if we can continue to do business. I urge all Vermont businesses to take the restart plan seriously and put employees' safety first. The goal is to start these businesses with the minimal number of people necessary economically and safely operate. Industries are eager to get back to work. Thank you, Governor Scott, for your leadership, helping Vermonters get back to work. A special thanks to Secretary Curley and Deputy Secretary Brady for their tireless efforts, and for all those serving on the Restart Vermont Economy Task Force and puts Vermonters back to work. We truly appreciate all your efforts. Thank you.
Well, thank you, Bill. And now we'll hear from John Connor of Connor Construction.
Good morning. Thank you very much for including me in today's news briefing. I'm a member of the Governor's Economic Mitigation and Recovery Task Force Restart Vermont Action Team, and I'm pleased to join the Governor to help implement this next phase of the state's Work Safe program. This economic impact and challenges of this disaster have been felt by our company, our construction colleagues, and most importantly, our valued employees. The Restart Vermont Action Team is working with industry sectors to help them identify a safe and measured reopening strategy. Even before this action team formed, the governor and his team were working with the Associated General Contractors of Vermont to determine how to reopen the construction sector. Their work led to the creation of one of the first sector-specific reopening plans, and it served as the model now being used to open other sectors. The construction industry and the thousands of Vermonters who work in it are excited to get back to work. Employers are committed to doing so only after they can establish safe work practices. Later today, the Agency of Commerce will post the Associated General Contractors plan on the web so other companies can use it as their template for formatting their own plans. The AGC's plan has several important elements which ensure going back to work puts everyone's health and safety first. In addition to the standards the governor has put in place during the most recent phases, the plan thoughtfully considered phasing in different types of construction, starting with outdoor, heavy civil construction first, and then leading to interior construction later. This phased approach reduces exposure probability, and this has been the basis of the most recent phased construction restarts. The plan has mandatory trainings for all returning and new employees, and at the close of business today, AGC Vermont will have trained approximately 1,000 supervisors and trainers. And they have created toolbox training to be given on-site to their coworkers. The plan designates a site safety rep on each site who has the authority to enforce the COVID-19 safety requirements in their plan and training. And this is a best practice that the governor has directed all sectors to adopt. In addressing, it also addresses proper isolation for workers, engineering controls, hand washing, and proper PPE. It suggests the staggering of shift starts, breaks, and other gatherings to prevent large gatherings, such as meetings off-site, etc. It plans for what to do in the event of an exposure on a job site, and it mandates other best practices of the CDC and the Vermont Department of Health. Over the coming weeks, we look forward to safely returning to work, and the protection of hardworking men and women of our industry is our number one priority. The training, work practices, and procedures that we have established will provide uniform work practices for construction companies throughout Vermont. On behalf of my industry, I want to thank Governor Scott and his administration for their leadership these past 2 months. I want to thank the companies that put public health first and suspended operations to make Vermont one of the models of how to handle this crisis. I also want to thank the members of the Restart Vermont Action Team, as well as the leadership of Ted Brady and Lindsay Curley from ACCD, and everyone's efforts in ensuring safe work practices throughout the state. Thank you.
Thank you, John. Thank you, Bill, first of all, for doing business in Vermont, but also for the commitment to the health and safety of your employees and all Vermonters. So if we're all in this together, if we can make this work, then we can educate and train other sectors as well so we can get back to some sort of normal. With that, we'll open up for questions.
All right, everybody, we do have a hard stop today in a little bit over an hour, about 12:45, so please, one question with follow-ups on that topic, and we'll start with Calvin.
Thank you. Governor, last week you said that your original executive order never forced businesses to close, but just said that they had to suspend in-person operations and be creative in how they operate. I know you've laid out this newest guidance, but what is stopping all businesses from opening up at this point?
Well, again, some of the opening up of some of the other businesses in retail, for instance, was based on can they do curbside service? Can they keep providing the services that they normally do in a much different manner? With this, this is a little bit different. In some of these sectors, where they're in close proximity to each other, we're saying that you have to do it in this way, in this manner, with these safety precautions. If we do this right, it's my feeling. We hear a lot of talk about the second wave, what could happen in maybe September or October. If we do this, we build this foundation correctly and provide the training necessary, we may eliminate a lot of what other states are going to face in another 3 or 4 months because we've taken the precautions now and we built this solidly. So we've had a lot of commitment throughout Vermont of businesses and so forth to do the right thing for the health and safety of their employees, and we're counting on them to do the right thing here as well. So I have great faith in what we're laying out. I believe this could work. And again, we could be a model for other states as well. And again, we'd be preparing ourselves if this thing should flare up again in the fall.
And then just a quick follow-up. At the same time, we've heard lots of anecdotes from people about businesses operating when they shouldn't be, businesses operating out of compliance. Without a hard, without consequences or enforcement from the state, I guess what's the point of these weekly spigot turns?
Well, again, I think we're seeing the benefits of that as we speak. I think most companies have done the right thing because based on what they've done, based on what Vermonters have done, we see the data coming back within our state that looks really good. One of the best compliance rates in the country. So whatever we're doing is working. But when we look regionally, that's when I have concern. When we look, again, I keep track of the data every single day, not just Vermont, but of New Hampshire and Maine and New York and Massachusetts and throughout in Quebec. So what I'm seeing when I see, for instance, Massachusetts, to date, this week alone, there are over 800 deaths already. They're going to, one more day to go, they may hit 1,000 deaths just 180 miles from here to Boston. So that's why we have to pay attention. Even New York, I mean, we're still seeing, they had 2,000 deaths this week alone. So it's not over. And if we open up too quick, if we attract more people into our state, we are just one ember away of opening up this wildfire again. So we're doing the right thing. Vermont businesses and Vermonters in general are complying, and we haven't had to enforce that. We've led them to this, and they've complied and done the right thing.
And Governor, for businesses looking to get employees back on Monday for the training that they need to provide for their employees, what does it look like for them in terms of what they need to be doing, that documentation they need to be showing you when they're in the event going?
Yeah, I'm going to let Secretary Curley answer that, but I would say they don't have to show us. They have to develop a plan that works for them, that is at least to a certain level, and then they keep it, and then they have to follow the plan. Secretary Curley.
Yeah, what the governor said, we're looking for employers to have a plan, and they can reach to industry plans that we may post on our website. Right now, our agency is standing up a web page that will provide folks with some best practices, some examples, but also a template if they want to create their own plan. Maybe they're really unique and they want to create their own plan, but the idea is to get them to create a plan that puts their employees at the best possible scenario for health and safety. They create the plan, they put it on file at their own place of business. If an employee asks for that plan, they should be able to hand that over upon request. And if we needed to go into the business, if something went wrong, for example, and we asked for the plan, they would need to be able to hand that plan to us as well and hopefully show us that they're complying with their own plan. So that's our expectation.
Governor, we're gearing up now for full-time manufacturing and construction work in a couple of weeks. That also brings along the idea of child care. What's going on that front? Are we opening up child care centers, and how's that going to work?
Yeah, again, we'll be talking about that a little bit more this next week. We know that as more people go back to work, the child care is an issue. So we have our team working on that as we speak. So we'll be talking about that a little bit more next week.
All right, moving to the phones, we have Colin from 7 Days.
Hi, so I was just wondering if there have been any new cases at the Northwest Correctional Facility, and does the Department of Corrections still believe the outbreak there is contained?
Secretary Smith.
Colin, thank you for the question. Mike Smith, Secretary of Human Services. As you know, we have retested that facility this week. We had 7 new cases. Those new cases have been moved or are in the process of being moved to St. Johnsbury, and we're moving 16 cases that were previous positive that have tested to all clear to come back to the St. Albans facility. So 7 is the number of inmates. We're still waiting on the results for employees there as well, but 7 is the new number, which is, by the way, I just want to congratulate the Department of Corrections, who's done an amazing job in responding to that situation at Northwest Correctional, State Correctional Facility. They have done an amazing job in looking at how to move people, how to isolate people, how to make sure that they contain a spread in a facility. And based upon these results, it looks like they've done a very good job. Thank you.
Thanks.
Kat, WCAX.
Hi. Today we heard a couple of industries say they have specific restart plans, and we heard what those entail. When will we be getting a longer-term forecast for reopening Vermont? Right now, of course, it feels pretty week to week, but I know many Vermonters are asking us when we can see the data, can see those long-term projections. So I guess as we look to make data-driven decisions, when will we be setting some data benchmarks for what we need to see for allowing different sectors to reopen, and when will you be releasing those so the public can look at them as well and get kind of a map for how we're moving forward?
Well, again, I think if you look backwards on what we did originally and when we placed the orders to mitigate some of what we're seeing throughout the nation, and you look backwards, that'll give you a sense of where we're going. I will say that this is a big step when you think about it. This could put this first step, even going from 5 to 10 employees, means possibly another 10,000 people going back to work or more. When you consider opening up the sector the following week, if all the numbers hold throughout this week, that could mean tens of thousands more. I mean, these 2 sectors alone make up for about 50 to 60,000 people in Vermont, 50 or 60,000 employees through construction and manufacturing. So it's a huge industry for us. So that alone will open things up. We'll watch that for a bit. Again, as I said in my remarks, we'll be talking a little bit about more of the social aspect this week, and maybe a little bit of outdoor recreation and so forth. And then we'll look for other opportunities to open up. But I don't want to set false expectations. I don't want to put something out there and then not be able to follow through. So we'll continue to do the work we're doing at this point in time, trying to get us back to some sort of normal as quick as possible, getting everyone back to work as quick as we can.
So there won't be anything that says, if we open this sector and in the next 2 weeks we see fewer than this percentage of new cases, that we can then reopen this next sector. We won't be getting a map that says something like that.
No, but I did say that we will be looking at this hopefully on Fridays. We'll be able to open up something else. That's our plan. But again, it's really based on data, science, and not just for Vermont, because that would be looking at things myopically and just ignoring what's happening throughout the region. We have to look regionally. We're too small a state. We're not an island. We're not insulated from the boundaries mean nothing to this virus. So we have to look regionally. What's happening in Massachusetts, Boston area in particular, Holyoke, and what's happening in New York, that matters to us. And if something happens in New Hampshire, that matters to Vermont. So again, some of what we do is going to be based on what we're seeing throughout the region.
Thank you.
All right, Alex, the Journal Opinion.
I'm all set, thanks.
Avery, WCAX.
Governor Scott, I don't know if you've seen, but the University of Vermont Health Network is saying that they are projecting to lose about more than $150 million this fiscal year. If our largest medical network is facing this kind of issue, what can you say to smaller hospitals around the state that are maybe already having some issues financially?
Yeah, I highlighted this a number of weeks ago. This is something that is important to us. It's part of a pillar of our social fabric. We need our healthcare system to help us, and so it's really important to us. I would say every single hospital is under stress and duress right now, much like UVM Medical Center, because the elective surgeries, for instance, are not being allowed at this point in time. So that has an effect on their revenue source. So that's why when we talk about the $1.25 billion we have, and I know many people have already spent that 2 or 3 times, the healthcare system is important to us. We need to make sure that we're able to protect Vermonters. So we'll be watching that. And again, when we get in the aggregate, the magnitude of the issue facing Vermont, then we'll determine how we spend the money we receive from the federal government, because it won't be enough. I guarantee that. It just won't be enough.
And just a quick follow-up, is there any more on the plan to start elective surgeries again?
Again, hopefully, we are working diligently with the Hospital Association on that issue, and with any luck, we'll have some good news in the near future.
Thank you.
Tim, Vermont Business Magazine.
Hi, Governor. Just to follow up on Avery's question related that UVHN also mentioned not only the elective procedure issue, but also the surge sites they're also standing up. Is there, with the counts, the data showing counts being very, very low, is there any move or thought on your part to take down those surge sites, maybe move some of that money or some of those people into other areas?
Yeah, we'll be having a phased approach to disassemble those sites in a strategic way. I don't know, Secretary Smith might be able to speak to that a little bit further, or Commissioner Sherling, but I'll let Secretary Smith answer that.
I'll start, and then if Commissioner Sherling wants to add anything, we are looking at a phased approach of starting to sort of box up some of those sites and be on the ready in case we do. We'll start with the sites that are not staffed at the moment. We'll start with those sites first, and then we'll continue to shrink as we see appropriate. I do think we'll probably see surge sites around for at least the next 30 to 60 days, but not in the capacity that we've had in the last few months in terms of surge and where it's going. So, Tim, I think you'll see some movement in, I want to say boxing up, because we always want to be in the ready in case this turns on us. We always want to be on the ready to deploy again if we have to. So we'll see that. The one other thing I just wanted to sort of follow up on, too, we have not been standing still in this crisis with making sure that our healthcare system stays viable. There's been several programs that we have instituted during this crisis, including extraordinary relief programs, making sure that our designated agencies and our special services agencies are tended to, as well as hospitals, and making sure that we stay on top of the fiscal viability as we move forward. As the governor said, this is going to be an ongoing issue as we move forward, and you just saw the results at UVM Medical. That doesn't surprise us, and this is going to be something that we're going to have to pay close attention to as we move forward.
Mike, what sites are not staffed right now? Which other surge sites that aren't staffed right now?
Barry, St. Albans, Rutland.
All right, great. Thank you very much.
Brady, Local 22.
Hi. So I apologize if either of these questions have been asked. It's kind of hard to hear some of the beginning ones. So I was just wondering, with the slow reopens and, if employees go back, they have to get their temperature checked, wear masks, all that kind of thing. One, how is that going to be monitored? And two, if an employee does go back to work and doesn't see these things happening and they don't feel safe, what can they do to protect themselves?
Well, again, I'll let Secretary Curley answer part of that, but I would look at this like any other safety plan that these entities, whether it's construction or the manufacturing, have to comply with. It's their plan. It's posted. If employees don't feel safe, they have a right to grieve that in some respects. So it's up to the employers to make sure that it's enforced and complied to, just like every other safety plan that we have available at this point. Secretary Curley.
You bet. If you are back to work and you're concerned about your health and safety, you certainly can ask your employer if they do have a health and safety plan. If the employer has 10 employees or less, all of the employees should have taken the VOSHA and Vermont Department of Health training that is available immediately. So, but if you're still not feeling comfortable, there's a couple places you can report it. You could report it through VOSHA, or you could also report it through our website at accd.vermont.gov. There's a place it actually has a button that says report noncompliance. So these are confidential. You can report, and you won't, there will be no retribution for your reporting. We'll follow up and try to help people get educated. Thank you.
Thank you.
Chris Roy, Newport Daily Express.
Yes, good morning. Stepping back to earlier this week when Dr. Levine talked about expanded testing, could that potentially put a surge that you didn't recognize before, and could that put us back to step one?
I'll let Dr. Levine answer that, but from my standpoint, yes, the more testing we do, the more hunting we do, so to speak, the more we might find something. So I think that is something we're expecting, along with more people going back to work.
So could that mean if you find that there's a sudden surge, that you have to undo what you've done the past couple of weeks for opening the state?
So this is a great question because, as the governor said, we would anticipate an upswing in cases, not necessarily to the level of a surge, but you never know. When Secretary Smith just answered the question about the correctional facility, I believe many of the cases that were there were actually not symptomatic cases. So if you hadn't tested, you wouldn't know that they were there in the first place. But likewise, we have tested other rather large long-term care facilities and been totally shocked to find neither the staff nor the residents of the facility were test positive. So you never know what you're going to find. I think with the broadened case definition that I detailed earlier, that we may find more people getting tested for symptoms that they wouldn't normally have brought to attention before, or that would have prompted testing. And we know that there's a certain level of disease in a population that is asymptomatic, and we don't know what level that's at. We don't think it's real high, but at the same time, we'll learn a lot just from expanding the testing in that regard. When we talk about a surge, it's not just a number of new cases, because if that number of new cases is the numerator in a fraction where the denominator is a vastly increased number of tests, we may still find that the incidence rate of disease is not very high. It's just that we've discovered more cases with more testing. So it's always important to keep that perspective of looking at a rate, and also thinking about a rate of how many of the tests are you doing are positive, because again, when that denominator gets very large because you've expanded testing, you may not be as alarmed by the number of positive tests when you put it in that perspective. Does that help answer your question?
It does. But I was just wondering then, would that mean you might have to close up businesses again if you see an uptick.
No, that's a great corollary question to ask, but again, when we look at things in terms of rates and when we put it in those perspectives, it may not indicate any greater degree of disease in the population than when we started. But that's why all of the parameters that I've recited previously and some of the slides Commissioner Pichak showed today are critical. We have to follow all of that and integrate that data together to really get a good understanding of a true upsurge versus just a lot more testing and seeing more cases.
Okay, thank you very much.
I just want to follow up, Chris. This is exactly why we need to take this very strategic, methodical approach and watch the data so closely. We don't want to flip the switch. We don't want to move too quick because we don't want to pull back. We want to, if we find that the cases are starting to elevate to a level that is alarming to us, we'll just slow down. We don't want to pull back. So that's why we're doing it the way we're doing it, and hopefully we'll have success. We think we have done well so far, and we'll continue along this path.
All right, Aaron Digger.
Is likely for Governor Phil Scott. The legislature is currently considering two bills related to relieving Vermonters under COVID, an eviction moratorium and a hazard pay bill. I'd like to hear your position on both, and particularly whether you are at all prepared to veto the hazard pay for essential workers.
Yeah, I think way too early to talk about vetoes when it hasn't even, I don't believe it's even passed one body at this point. So it's got a long ways to go. We'll continue to monitor that. I understand it's a noble effort, and I understand what they're trying to do. My question always goes back to, where does the money come from? Is it coming out? We don't believe that the CARES Act money can be used for this purpose. So if we're going to move forward, where is the money going to come out of, like the general fund, which is, we're already seeing stress for this fiscal year, and we know there's going to be a $300 to $400 million hole in next year. So again, it comes down to money, not the cause. And in terms of the other, we've been working closely with them. As I said, I believe I said this Wednesday. We could have put in to an executive order the foreclosure, eviction, elimination, or during this crisis, but I chose to work with the legislature instead. We're working along with them. We think we're getting to a good place, but we'll wait to see what the final version is when it passes the legislature. But we're working side by side with them on that.
Okay, and related to the eviction moratorium bill, do you know if any Vermonters have been evicted since the start of the crisis? And if so, how many?
Yeah, I'm not aware of that happening. It's a long process, and when you consider when this really started 7 weeks ago or whatever it is, it takes a while to get through, start an eviction process and then complete it. So I don't know for sure, but from my standpoint, I haven't heard of any evictions.
Okay, thank you.
Lisa, the AP. Lisa, AP. All right, we're going to move to Austin, the Burlington Free Press.
Hi, yeah, I think this is for either Governor Scott or Dr. Levine, and just looping back to a question I asked a couple weeks ago regarding golf in the state, because it looks like after this weekend we're going to have, I think, 5 states, or less than 5 states, with restrictions in place on playing the game. And I'm curious, at this point, what is it about golfing in Vermont that's less safe than Vermonters going to New York or Connecticut to do so? How is it less safe than dozens of people using the Burlington skate park at the same time?
Well, again, as I said in my opening remarks, maybe you missed that part, but I did say that we were going to review some recreation if the numbers continue to hold, and we'll be hoping to announce something next week.
Okay, I didn't catch that. It might have been an audio glitch on my end because I heard from a lot of folks, dues-paying members, wondering, or even if they are a member of a club, wondering why courses couldn't only admit Vermonters at this point.
Yeah.
That was...
I would also remind everyone, this is May 1st. We could still get a snowstorm right now. So from my standpoint, we're still in early spring. So it's not as though we're all that far behind other years. But again, we're going to review that this coming week.
Thank you.
Greg, County Courier.
Hi, Governor. This week we had a story on the effect of COVID-19 and dairy farmers in Vermont. And one of the discussions that or one of the topics that we touched on was farmers' concerns that they're having to dump milk because of a glut of milk. And in supermarkets, many supermarkets are limiting food supplies to consumers, like 2 gallons of milk per customer, which is, if you have a pretty big family, 2 gallons of milk is not going to get you very far. So there's a lot of farmers that are asking why you couldn't have an executive order to restrict markets from doing that. Would you entertain that idea? And if so, or if not, why?
I haven't heard that. I heard it initially for some reason, but I was assured by Secretary Tebbets that was no longer the case. I'd be happy to take a look at that and confer with Secretary Tebbets, but you're right. I mean, we have an overabundance amount of milk, and I know that some farms and other entities are dumping milk at this point. So it doesn't make much sense to restrict when we're in that period of time. So I'd be happy to take a look at that, but I don't have anything that has been brought to my attention to that degree.
My understanding, speaking with Secretary Tebbets on Wednesday, was that his agency sent out a letter to all the markets, but that was dated like a couple weeks ago anyway. And at least here in Franklin County, there are still markets that are limiting how much people can purchase.
Yeah, if you could let us know who that is, let Secretary Tebbets know. We'd be happy to confer with those entities and see why they're doing what they're doing.
Certainly. Thank you, Governor.
Pete Hirschfeld, BPR.
Governor, you said that your decision to open up the manufacturing and construction industries is born out of your faith in their ability to adhere to strict worker safety protocols. What prevents you from having similar faith and trust in the ability of other sectors to adhere to those protocols who are going to be having to stay on the sidelines for a while longer, it sounds like?
Well, again, Pete, that's just exactly what we're doing. We're conferring with every sector. It just happens to be that the manufacturing sector and construction sector, some of them, especially in construction, outdoor work and so forth, was more conducive to what we're trying to accomplish here to keep people safe. But we are asking other sectors to work with us, come up with plans how they can, it's the how they do this rather than whether or not they will. So we're working on that. Again, we just took 2 sectors that are major contributors to the workforce here in Vermont at this point, and have a track record of having to comply with very stringent safety requirements and following detail and plans and so forth. So they're accustomed to this, and so it just seemed like a natural place to go for such a large sector to put a lot of people back to work that are accustomed to this type of thing. But they're very willing to share the models that they've been able to put into place, and we're willing to work with them as well. I'll have Secretary Curley add to that as well.
Yeah, I just wanted to remind people that it's not just the construction and the manufacturing that are able to work in part. So there are services that, like if you're in real estate or appraisals, town clerks. Now we have permitted people to open up. Again, very strict guidelines about keeping 6 feet apart and limiting it to 2 people interacting. Retail, the governor had encouraged curbside early on, and at this point we're at if you can operate with the minimum number in your store, you can offer curbside again, keeping the distances between people. So just want to make sure that people aren't thinking that we're only opening manufacturing and construction. We have been slowly trying to encourage folks that can work, either still continue to work remotely or can work with keeping safe distances to do that work.
And just one quick follow-up. Does the order that will become effective May 14th, it sounds like, mean that traffic projects will be able to begin resembling what we saw pre-COVID?
I think, again, I'm just going to caution anybody to think that we're going to be pre-COVID right away. I think, yes, you'll see projects, if things are going well, you're going to see construction sites having more people, but again, we're really going to continue to encourage them to make sure everybody is properly distanced. They are able to, right now, as of Monday, they can go to 10 people per site, but again, we're saying spread out and make sure it's 10 people per location. We don't want people on top of each other. So even when we open it up, sure, you can bring a larger crew back, but don't forget about those proper distancing.
Thank you.
Joe, Barton Chronicle.
Hello. I was wondering about places like garden centers. I know that they're opened up and there is a restriction right now of no more than 10 people, customers and staff included, as I understand it, allowed at a time. I've frequented such places and I've noticed there's a large difference in size of various businesses, and I'm wondering whether at some point there is going to be a move towards opening things up a little more based on, say, square footage, places that can allow more people to be present with the necessary distancing.
Yeah, a couple of thoughts on that. There was a requirement in there, a square footage requirement that you couldn't exceed a certain amount, and I can't remember what that was. So you could have up to 10, but that doesn't mean every entity could have 10. So we'll be looking at other ways, as you remember, that we, at that point in time, even from a federal standpoint, there was a limit of the number of people gathering. We still have that in our executive order of 10. So we're trying to grow that as we speak. So we'll consider that in the future. I'm sure that with other entities opening up, you'll see the square footage requirements and so forth to make sure that we're socially distant or separating ourselves as much as possible, or physically separating ourselves as much as possible when we do open up different sectors.
Just to follow up, so am I understanding that you're speaking about maintaining the limit of 10 people, but just finding more businesses that can do that? Or are you actually thinking in terms of allowing businesses that can accommodate more people safely to do so?
I think you'll see that in the future as we expand and try and, again, we're just doing this in a measured way and watching the data and the trending. And if we see positive results as we keep moving forward, you'll see an expansion of that so that more people can go back to work in different areas and different sizes. So at this point in time, we just wanted to try and limit it as best we could and to allow the business to open it back up, put more employees back to work, but do it in a very methodical way. So I would say in the future, again, that's part of the strategy, is to see, it's a space requirement as well, so that we'll be able to expand the number of people in any one place, based on square footage, but we haven't arrived at that at this point. But you can expect that.
Thank you very much.
Sean, Chester Telegraph.
Thank you. This is kind of a question that we've been getting, a type of question we've been getting from readers. There's evidence that people shed the virus at the highest rate just before they show symptoms like fever. So why doesn't the administration mandate the use of masks for everyone, especially in buildings that are open to the public?
I'll go first and then let Dr. Levine answer after. There's been a few states that have made masks mandatory for everyone. I'll go back. I answered this the other day, and I think it's a compliance type of issue. We have a high rate of compliance. Social behavior is changing. It's a culture change for each and every one of us to wear masks when we go out. And we're seeing more and more compliance. We're seeing more and more people doing it. So I'd rather lead people rather than force them to do something. In certain circumstances, as I said today, for mass or public transit, we're requiring those customers, those riders, as well as those employees to wear masks because it's so confined and you don't always have a choice. But we're seeing other stores. I believe I heard that Hannaford is the latest that may be requiring facial coverings in stores for customers, as well as we saw Costco the other day from a national standpoint requiring that. I think we'll see more and more people doing that. So why, the enforcement piece of it is, what are you going to do? Are you going to start citing people who don't? And I'd rather not do that. I think that education and guidance is a much better path to get compliance. And we just want to do the right thing for the right reasons. And I think at this point in time, I'm just seeing more and more Vermonters doing the right thing. Dr. Levine?
Can't add too much to that. Clearly, we are concerned for employees, and there are some rules in play for that. But for the clients and customers of businesses, this really is a change in norms, a societal norm. And other societies have done this quite readily, and I'm sure ours can too. The governor's been fond of reciting the statistics that I provide in my informal surveys, and I've continued to do those, and the numbers are increasing. My wife even confirmed that yesterday in another large food establishment, that grocery, that she was not seeing a lot of people who were not wearing facial coverings. So this is beginning to happen in some of those large businesses, like the Costco's and the Hannafords, are helping us create that cultural norm because they know it's going to be protective for their own employees and for their other customers. So I think that this is not the kind of change in society that we can accomplish with rigid enforcements. I'd much rather have the carrot approach and allow the society to move along in the right direction. And if the business community wants to aid us in that, that's a wonderful thing because they know ultimately it is the right thing to do.
Just to follow up, we do see a fair number of people who are not wearing face masks in places like stores. And I'm wondering if the governor could address the message specifically to the sort of person who's going to say, no, I'm not going to do it.
Yeah, well, again, until it's not mandatory, they're doing others a disservice by not complying, and because it's really altruistic, it's something that protects others from possibly you may be asymptomatic, but you may be carrying the virus unknowingly, and you could transmit it to others. So it's just a really good idea to do, and again, it takes some time to get accustomed to this. Think about, we've been into this now about less than 2 months, and all the changes that have been made over these last 2 months, and really masks has just become more and more prevalent over the last 3 weeks. So it just takes a little time. It seems like an eternity, but I'd say the compliance rate is looking as though it's increasing. And I think, again, the more people who do it, when we require them in the manufacturing facilities and on the construction sites, I think you'll see more compliance that will you'll see in the general public as a result of the actions we're taking in these certain entities.
Thank you.
Mike Donahue, the Islander.
Thank you. Readers have noted some of these Vermont statistics or cases are getting pretty old. Is there a way for the health department to tell residents how many are really active in each town and how many have passed, say, the danger period on these numbers?
Dr. Levine.
So my understanding as of today is that the way the website is arranged for the numbers per towns, it gives a date parameter so that you know the date that is the beginning date and the date that's the ending date of the time period that the map reflects. And then that continues to get updated as time goes on. Does that help answer?
Well, no, because I did see that the new numbers got posted, but like the cases that get tested positive back on March 5th or so, are those people still in the danger period, or are they back to work and it's not a concern anymore? And I do note that the new adjusted numbers have been put up there. St. Albans Town apparently has 38 cases, and Swanton now only has 7, but Putney's been added with 6. And we were told that the out-of-staters who are tested positive in Vermont, those numbers are actually sent to their home states. So we don't see any of those numbers. I thought those were going to be forthcoming. And readers also asked, if Vermonters are tested positive out of state, where do they show up, or are they showing up on the Vermont statistics?
Yeah, they actually show up in Vermont statistics, and they may have a lag period depending on when we get that statistic, whether they're just a case, whether they're a death, God forbid. Those numbers come back to the state that the person has residence in.
Will we be able to see those numbers? So much like I thought we were going to get like Massachusetts and Maine and others that are testing positive in Vermont. I thought we were going to be getting those.
So on our daily report, the number of cases that we report each day do include those that are out of state and those that are in state. What you see on the map, though, is by the place of residence of the person, and you're only going to see the Vermonters there.
Well, maybe I'm missing it, but I don't see like the out-of-staters that are tested in Vermont, that those numbers are being listed anywhere. Like there were 10 in Massachusetts, 5 from New Hampshire, 20 from New York.
Yeah, so I think you're making a great point. I mean, you want a more comprehensive view of the numbers and the place of origin of the people who are testing positive. So because this part of our website is just so new, let me work with my staff and get back to you on that so that we can give you the kind of data that you're looking for, okay?
Especially the ones that are out of danger now. I mean, like the Burlington numbers, are how many of those are really active cases versus those people, half of them have gone back to work?
Right, so you want a clearer idea of the percent of those who are recovered.
Yeah.
Which we are tracking in our follow-up case contact interviews.
Thank you. Thank you very much.
Patricia, Bennington Banner.
Hello, can you hear me?
We can.
Awesome. So I'm wondering, this would probably be a question for the governor, what should businesses do that are able to open but aren't able to meet the new temperature check requirements, not due to a lack of trying, but due to an inability to get enough or perhaps any supply of thermometers? What should they do?
Yeah, again, we're asking them to do the best they can, to do the survey of their employees as they come in, recognizing the fact that thermometers are in short supply at this point in time, but we would ask them to at least place the order. try to do all they can to get the instruments they need to take the temperature checks. But again, we're just trying to get to a point where people will. I mean, I went and ordered some the other day myself just to see how long it will take, and we'll, it's almost, we'll see how long it takes for me to get them. But we have a number of them on order through the state as well. We're hoping that they will come in eventually. But again, we're just asking the businesses to do the best they can under these conditions.
So they can still open if they are literally not able to get the thermometers. They just have to continue to survey employees for symptoms, do everything else they possibly can.
Yes, that's correct.
Okay, thank you.
And Wallace Allen, Digger.
Hi, this question's for the governor. Governor, Stronger Vermont, a political action committee that was supported by the Republican Governors Association, put out a digital ad highlighting your leadership during this crisis. I think that's the same PAC that has supported you in the previous 2 elections. I'm wondering what you think about their running the ad. I assume you guys probably talked. Do you think it politicizes your work? And I also have a follow-up.
Again, and I have not seen it myself. I don't interact with anyone. We can't coordinate. It's nothing that I have anything to do with. It's out of my control. But it's nothing that I've seen.
Okay. My other question is, you said that you were going to announce at the end of the legislative session whether you're going to run again. And at the time, we all thought that meant May. But as we know...
This is a COVID update, and we said 1 question, so I'm going to, if we have time at the end, we'll come back to you, but we do have folks left in the queue, and that's an off-topic question. We have hard stop. I'll come back if I can. Pam Davis, Vermont Journal. Pam Davis, Vermont Journal, star 6 to unmute.
Am I can you hear me?
We can.
Okay, thank you. This is a question really for the team. All of the governors' quarter turns, or I don't know how many they've added up to, but all the changes of the opening, early cautious opening changes have taken place against the backdrop of tremendously favorable numbers going forward. I wonder if you look how far you're looking ahead. For example, we're surrounded by states with hugely more virus potential than we are. But more important, we're going to have the UVM and Middlebury both are planning to open in the fall. They're really going to have to get schools back into classrooms because it just doesn't work almost at all without it. And so what I'm curious about is whether your team, Governor, has been starting to think about whether you're going to have to really start leaning on what's called herd immunity. In other words, whether you're going to have to take bigger risks than you have had to take in the past. Has your team talked at all about herd immunity, and what do they think about it?
Dr. Levine.
Thanks for this question. We actually have, with the health department, weekly phone calls with a number of the colleges and universities in the state, working with them and helping them try to plan. They have a very realistic view of the future and are being appropriately cautious, but also trying to be optimistic, as they should. The issue of a student returning to Vermont, let's say they're not in Vermont and they're coming from another state, at this point in time, we have a quarantine in place for people who are coming from another state. So clearly there would have to be some lead time for that individual before they arrived at school. And the campuses are actually quite aware of that. Campuses are also thinking very openly about modifying their dormitory structures and how many people can live on a certain floor, single rooms, things of that sort. So they're thinking very, very expansively, if you will. With the concept of herd immunity, It's probably occurring to some degree right now, and we don't have as accurate an idea of that just because we don't know the numbers of people who would test positive and are asymptomatic. When we unveil antibody testing, which we will do when the technology is appropriate and accurate and right, we will have a better idea of that to get a little better handle on it. But most of the people who are guessing at herd immunity in the country, never mind Vermont, are thinking that we do not have a large proportion of the population who have been exposed yet. And they're not thinking in the 20 to 50% range, they're thinking more in the below 20% range, sometimes significantly below. So I'm kind of, as a clinician and a public health individual, I'm a little concerned about the fact that a huge proportion of this population might get exposed to develop that herd immunity, because we know from some of the hot spots around the country that once that starts to happen, where you get a higher prevalence rate of viral testing positive, you find that there are not only the older and more vulnerable members of society having some of the severe consequences of the virus, but you find it in the younger part as well. So we don't want to get to a level where we have a lot of unprotected people. They then get exposed to the virus, and they may not have as favorable an outcome as we'd like to see. We're trying to balance this balancing act of all of the appropriate mitigation and containment strategies ongoing, and at the same time hoping that we'll get favorable reports like we just did get from scientists regarding remdesivir as a possible improved approach to treating the seriously ill with COVID. It didn't improve mortality in the very early phase, but it did reduce the number of severe days of illness. So we're hoping to hear more favorable news like that in the viral therapeutics realm and, of course, in the vaccine realm, and see if those can get us there faster. But knowing that there's a certain level of asymptomatic transmission of virus, there will be herd immunity developing to some extent. As you know, the wild card in this is knowing what immunity means with this particular virus, and if having antibodies to this virus is protective for you for the future, for the next go-around, so to speak, or if you will not actually have as much resistance as we'd like you to. Does that help answer your question?
Yes, very much. I appreciate that. Can I have just one quick follow-up? If the question, if you do have these colleges coming in, the president of Brown University laid out a sort of track how a college could do it in a recent article in the New York Times. If you do that, if you follow the sort of the Brown University model, you're going to what she says is that you need tremendous testing of the college populations, not only before they come into the school itself and begin to go into dorms and stuff, but also to be able to subsequently test them also through the year. Do you have any sense yet of whether your reagent supply will hold up for that?
Yes, thanks for that question. Part of the strategy we unveiled earlier this week with our more offense-minded and expansive testing strategy has a category for what we term returning Vermonters, whether those be returning Vermonters from living in the South during the winter, or whether those returning Vermonters be students coming back to school to begin their next year of college. We've incorporated all of those numbers in our projections and understand that there would be a demand for testing as well as a significant demand for an element of quarantine in those populations when they come back. So unless something changed dramatically nationwide in the reagent side of things or in the collection side of testing, I would think it's completely within our possibilities to incorporate the students into that whole expansive regime.
Thank you very much.
Guy Page?
Good morning, Governor. The updated order says all businesses and nonprofit and government entities. Does this mean that churches and other religious bodies can meet for worship again, provided you follow the guidelines outlined?
Those still remain. No gatherings over 10, and we're allowing for those drive-in opportunities for religious services. But again, we'll be looking at that throughout the next week or 2 weeks in terms of the social gatherings and so forth. So it's, again, part of what we're going to be looking at, but I can't give you a timeline at this point.
Did you say that you do allow the drive-in?
We have, yes. No, we have been all along allowed for drive-in.
Okay. Thank you.
All right, that was our last questioner, so we do have time to go back. I believe Ann Wallace-Allen had a second question. Ann, go ahead.
Hi, thanks, Rebecca. As I was starting to say, you said you were going to announce, Governor, your political plans at the end of the legislative session, and that's usually May, but as we know, the session's going to run into August now. Do you have a timeline for letting us know whether you plan to run for another term?
Yeah, I don't. It's probably been the last thing on my mind. I've got a lot on my plate, as you might imagine, these days, and so that hasn't been something that I've been considering. I will also add, though, that when I was in the legislature, we did go into June, fully aware that the legislative session doesn't always end in May. Sometimes it does go into future months, so this isn't out of the ordinary, but it may not be typical.
Okay, thank you.
There we have one more question in the room. Go ahead.
Governor, on the smaller business end of things, another one of the areas that we're getting a lot of questions about are personal care people, whether that be manicurists or hairstylists. I need a barber. What's the story with them? Are they going to be allowed to get back to work?
Yeah, hopefully everyone is going to be able to go back to work at some point. Again, we're just trying to do this strategically, methodically. We have a group that's working on this, and I might ask Secretary Curley if she could elaborate on that. But our goal is for everyone to be open back up as soon as possible, as soon as it's safe.
Yeah, as the governor mentioned, we are talking about this. Dr. Levine would probably back me up to say that the greatest concern right now is contact. So with salons, hair, and whatnot, you need to touch somebody. So right now, we're still trying to work through it, but as of yet, we're not ready to lift that.
Thank you very much for tuning in, and we'll see you on Monday.